Welcome to The Explainer. Today, we're diving deep into a really critical medical topic, the aneurysm. We're going to break down what this dangerous bulge is, where it can happen in your body, and exactly why it can be so deadly.
So, to get our heads around this, let's kick things off with a simple picture. What in the world does a weak spot on a garden hose have to do with your body's biggest artery? Well, think about it. Both can develop a dangerous bulge when they're under pressure. And that bulge, that's the key idea we're digging into today.
All right, first up, a dangerous bulge. Let's get the official definition of an aneurysm nailed down, and more importantly, figure out why not all of these bulges are the same. Trust me, the difference really matters.
You know, when it comes to the clinical diagnosis, it really just boils down to the numbers. An aneurysm is officially a bulge in a blood vessel that's grown to 1.5 times its normal size. It's a pretty simple rule of thumb, but it's absolutely critical for doctors.
Okay, now this is where things get super interesting. We have to talk about the huge difference between a true aneurysm and what's called a pseudo-aneurysm. A true one is when all 3 layers of the blood vessel wall are intact, they're just bulging out. But a pseudo-aneurysm, a false one, well, that's way scarier. It's basically a hole that's been plugged, a contained rupture where the wall isn't fully intact, and that means the risk of it blowing out completely is way higher.
So, what causes these really dangerous false aneurysms? Well, it's usually some kind of external event or an underlying disease. We're talking about things like physical trauma, a complication from a heart procedure, a nasty infection setting up shop, or inflammation from something like pancreatitis.
Okay, let's shift gears and focus on the main event, the aorta under pressure. This is the body's superhighway for blood, and it's also the most common and most dangerous place for an aneurysm to form. And when we talk about the aorta, there is one main culprit that shows up again and again and again: atherosclerosis. You know it as hardening of the arteries. It is, by a long shot, the #1 reason aortic aneurysms happen.
The absolute biggest fear with any aneurysm is that it's going to burst. So how do doctors know when it's about to go? They look for these really specific, ominous signs on CT scans. There's something called a hyperdense crescent sign. That means there's already some bleeding inside the wall. Or a draped aorta, where the back of it is just sagging against the spine. You see those things? Or if it's growing really fast or the person is in sudden pain, those are massive red flags.
So, when it all comes down to it, when a surgeon has to make that critical decision about whether to operate, it all boils down to one simple phrase: sac size matters. That maximum diameter is the single most important factor they look at.
But hang on, it's not always about wear and tear or lifestyle choices. Sometimes, the danger is literally written right into your DNA. Let's talk about some inherited syndromes that make blood vessel walls dangerously weak from the start.
First on the list is Marfan syndrome. This is a genetic condition that messes with the body's connective tissue. And in the aorta, it creates this very specific look at the base, right where it leaves the heart. It's called a tulip bulb aorta because, well, that's exactly what it looks like. It's a classic sign.
Next up is something called Loeys-Dietz syndrome, and it has this classic 3-part signature, a triad of signs. The first is hypertelorism, which just means widely spaced eyes. The second is a bifid uvula. That's when the little thing that hangs down in the back of your throat is split in two. And the third, the most dangerous one, is an aortic aneurysm combined with arteries that are super twisty and tortuous.
So, how do these two compare? Well, if you have Marfan's, you're at risk for aneurysms. But Loeys-Dietz, you can almost think of it as a much more aggressive, much more dangerous version. The outlook is worse, and those aneurysms are much more likely to rupture. It's a really serious condition.
And then there's Ehlers-Danlos syndrome. Here, the problem is with collagen, which is basically the glue that holds your body together. This makes the blood vessels incredibly fragile and prone to tearing. The risk is so high, in fact, that doctors have to avoid even routine procedures that put catheters in the arteries if they can.
All right, time to put on our detective hats for this next section, the unusual suspects. We're looking at cases where the cause of the aneurysm isn't your typical atherosclerosis or a well-known genetic disorder. First, we have the mycotic aneurysm. Now, the name is a little tricky. Mycotic makes you think of a fungus, right? But in this case, it just means it's caused by an infection. If a radiologist sees a weird, pouch-like aneurysm, especially up high in the aorta, the first thing they're going to suspect is an infection.
Here's a real throwback, something you hopefully won't see much anymore:
the syphilitic aneurysm. If syphilis goes untreated for a very long time, it can attack the aorta and create this heavily calcified bulge that has this classic and very weird tree bark look on a scan.
Now this next one, Loeys syndrome, isn't a bulge, but the total opposite. It's a complete blockage of the aorta down in the abdomen. It shows up with this really stark, three-part clinical picture: impotence, claudication, which is just pain in your butt and thighs when you walk, and you just can't feel a pulse in the legs.
And for our last unusual suspect, we've got something that's purely mechanical. It's called median arcuate ligament syndrome. Basically, a ligament that's part of your diaphragm pushes down and pinches the celiac artery. On a scan, it creates this distinctive hooked shape, and it actually gets worse when the person breathes out.
Okay, so we've seen all these different types and causes. But what does it all mean in the real world? How does a doctor look at all this and decide, all right, it's time to operate? Let's get into the key numbers that guide that huge decision.
This table here lays it out pretty clearly. It's all about location and size. For the thoracic aorta, the part up in your chest, the magic number for surgery is usually 6 centimeters. But look, if you have a connective tissue disease like Marfan's, they don't wait as long. The threshold drops to 5.5 centimeters because the risk is higher. Down in the abdomen, the aorta is smaller, so the threshold for repair is also smaller at 5 centimeters.
And all of this brings us to the big final question. We've got causes that range from the code in our very genes to just the simple wear and tear of a long life. The challenge now is, how do we get better at predicting these silent threats before it's too late?